everyone, and welcome back to another episode of Making a Difference in Mental Health. I'm your host, Danielle Young. I'm flying solo today, but my co-host, Wendy Grier, will return. Today, we're going to continue the conversation about COVID-19, the pandemic, and the impact that it's had over the past 2 years, and we're going to hear it from the therapist's perspective. Enjoy. And I am here today with my special guest, Dr. Trey. She is one of our special colleagues here. I know her very well, but Dr. Trey, can you introduce yourself to our audience?
Good afternoon, good evening, good morning, wherever you're hailing from. My name is TreSina Steger. As Danielle says, I'm one of her colleagues out of the Greenbelt office. I've been with Advanced Behavioral Health. I started here as an intern back in 2019. I was out in the field, and then I came back in 2021 as a licensed therapist. My background stems from working in human resources for a couple of decades, working in the federal government for 11, 12 years, and I retired. I do professional voiceovers, yes, and I do professionally sing. So, and then I came as a second career into working with people in mental health. So that was my calling. That is my calling. And so that's just a little bit about me. So now I'm here contributing to the podcast. Thank you.
Absolutely. And I just want to personally thank you for just allowing us to interview you and kind of pick your mind about the topic that we're going to talk about today about COVID-19. So it is definitely an honor for you to be here with us. And thank you again for your time. We're going to go ahead and get right into our questions for today. I'm just wondering, from your perspective, we are still in COVID-19. There have been so many different variants that have come. There have been so many different impacts in different industries. Of course, we're in the mental health industry. But specifically, how has this pandemic impacted your work?
Okay. Now, as I stated earlier, I was an intern with Advanced Behavioral Health. And being able to go out and see my clients was one thing. Being able to actually sit in front of them. Coming back, I graduated in 2020, right at the onset of the pandemic. So as everything was shut down, I was graduating. When I came back as a licensed clinician, telehealth was the up and coming thing because we're trying to stay safe. So, and we are staying safe. So it was new to me, but it is a good thing. So being able to reach more clients, that's it. And be able to address their needs. So impacted, in a good way for me, and to be able to help the clients. So that is one of the ways that has impacted my work. Also, the flexibility, I'm going into probably another question here, but thank you for allowing me just a little bit of liberty to do so. The being able to, now that we're into the second year of this pandemic, and although people are getting vaccinated and getting the booster, the hybrid model, being able to see clients in person, if they so choose, in the office, in the residence, or wherever, having that flexibility has been good as well, because I'm seeing clients who, if they have more needs or more challenges, and they say, no, I don't want to do a Zoom, Ms. Trey, I don't want to, do that. I have that flexibility to go to them or come to me at the office. So that also works well with our clients. That's been good. And I've seen the migration over the last year or so to going from total telehealth to the changing regulations and laws. So it's being flexible that has been key for me to stay in a space where I can help others.
And it's interesting, over the last year, even with the podcast, we've talked about the different benefits. We've talked about the flexibility. And then sometimes too, Wendy and I will get into this space where we talk about some of the challenges, even with telehealth. Now, you mentioned one good thing about being able to see your clients virtually, same as myself, being able to see them virtually, being able to have them log on. It's not a situation where we're driving to them and, we're fighting traffic. But then also sometimes there is that log on fatigue. Sometimes there's that Zoom fatigue. And so, like you said, the migration of coming back from solely virtual to kind of a hybrid situation and we all hope at some point where we're not zoomed out. I think that, we all kind of feel that way. Do you feel that way too?
Well, let me put it in perspective. I've already set my mind to that this space, whether you're using Zoom or a different platform, is our new normal. And I tend to alliterate or rhyme when I speak. So, I've adapted, I've adjusted, and I've admonished some old ways. So
Mm-hmm.
once again, I've adapted, I've adjusted, and I've admonished some old ways. So I've learned that telehealth, telemeeting, wherever
Right.
you put it, is
Yes.
our new way of life in some
Yes.
way. So whether you're, using social media, using FaceTime, using whatever method to communicate with people, you're going to have some type of virtual communication. So get used to it.
Mm-hmm. Mm-hmm.
If you are not used to it, it is here to stay. So,
Absolutely.
addressing the key um, of being virtual, there are ways and some coping skills
Mm-hmm.
to take yourself out of it. Okay, and
Right.
taking those times and taking those breaks and to rest your eyes.
Mm-hmm.
Okay, so I've
Yes.
learned how to do that. I'm already shifting. So anyone who sees this podcast and say, I need to learn a coping skill, take your eyes off of it for 30 minutes, take
Right.
a break, and then
Right.
get back to it. But I know sometimes that's easier said than done.
It is easier said than done sometimes. And even for the podcast, I am in our podcast studio, and, it's still a work in progress, but we would love and we would have the desire for all of our guests to be with us live and in person. But even this is an adjustment. Even this is we're in season 2 and we're still working virtually. But the fact of the matter is we're still going. And we're still adapting, like you said, and we're still adjusting. I wanted to kind of talk about your clients for just a little bit. What are you seeing over the past 2 years? What have you begun to see that's maybe symptomatic of this time? Because, like you said, it's an adjustment, but we are in a new time. I know in my lifetime, I've not had this. I don't think in my parents' lifetime they've seen this. If I could go further back to my grandparents or my great grandparents, there may have been something, but not a time like this. So what are you seeing or what are you observing as a clinician with a caseload of clients that's symptomatic or, that is something that would specifically speak to COVID, would specifically speak to symptoms that have developed as a COVID response?
Developed. Okay, I'm thinking
Mm-hmm.
things that got more or exacerbated actually because of COVID.
Mm-hmm. Mm-hmm.
I'm seeing, we already started to talk about Zoom fatigue, but I'm seeing just decreased attention span. I'm hearing clients say, I didn't have this before COVID, but now I
Exactly.
can't pay attention to anything.
Exactly.
I'm seeing more substance use. I'm seeing that. I'm seeing
Mm-hmm.
just a lot of anxiety. I didn't have this before. I was
Exactly.
anxious. Social anxiety. I don't want to leave the house.
Mm-hmm.
I don't know why. I'm seeing a
Right.
lot of that and just breaking into those, okay, it's time to go back outside. Okay, remember what you used to do, working with clients with those types of things.
Mm-hmm.
I'm seeing a lot of it.
Exactly. An increase in anxiety, the social anxieties.
Yes.
For some of the children that we work with, especially our school age children who have been virtual for almost 2 years, who are now back in school, even developmentally, I find that some of them are just a little bit behind, and we see these social anxieties even with their peer groups. And at first, what I would like, and Wendy and I, we often talk about this, is to see somewhat of a case study, maybe 10 years from now, of this cohort of students and children this age, to see what has developed, or as you said, has been exacerbated over time. And, even parents experiencing some adjacent anxiety because of their what are you seeing when it comes to parents?
Now, let me step back really quick on the
Sure.
students, 11 to 14,
Mm-hmm.
especially that age bracket. And when they're going, they were with their peer group in school year 2018, 2019. And then
Mm-hmm.
they're starting to grow and change. And
Mm-hmm.
then COVID hit. their social group has changed because now
Mm-hmm.
they've been out of school over 2 years, and now they've entered high school, they've entered middle school. So that social development has changed with that group of students. So now the parents are now involved in that they've had to change jobs. So it's like a tumbleweed effect. It's like a snowball.
Mm-hmm.
And
Yes.
so how it's affecting the parents, may have not just that child in that age bracket, but they may have multiple children. I'm seeing them affected. I mean, it's just a whole of issues with um, with our children, especially in that age bracket. Another age bracket too, where children entering thought they were entering kindergarten or first grade, and they can't enter the school because of maybe vaccine issues, or they
Mm-hmm.
can't go because of just a whole magnitude of issues and new regs and those types of new laws and just like I said, I'm just thinking of one thing that comes to mind: ever changing guidelines that are
Mm-hmm.
coming
Yes.
down. So I notice my older youth that are on my caseload, they've adapted. Some of them have adapted a little easier than the
Mm-hmm.
younger youth on my caseload. So
Mm-hmm.
that's what I'm seeing the most. And the parents, it's a whole, and my adults on my caseload too. I'm seeing a whole different dynamic with
Yeah.
them. It's more occupational.
That's a You bring up a number of good points. I'm going to steer away from our questions just a little bit because I want to
Mhm.
touch on something that you say. I work with the community schools program for advanced behavioral health, and when I tell you that, many of our kindergarten, first and second graders are having a real challenge with transitioning into being in person versus the virtual. Some
Mhm.
of my students, when they started school, they started virtually. So they were
Right.
in kindergarten, or they were into kindergarten third quarter, and then we know that by that March it was completely virtual, and for the entire rest of the year, even into last year, it was completely virtual. So those skills that they would have learned, those social skills that they would have learned between the ages of 5 to 6, now they went from kindergarten and now they're in second grade. And some of those social skills that they would have learned being
They did
in the
not.
school environment, being with their peers, developing certain social groups and social cues, they're just having a really hard time. And then on
Grasping.
top of that, when you spoke about the parents, it's so funny because a lot of the parents that I had during that time, they were like, I have to become the math teacher, I have to become the spelling teacher and the arithmetic and this and that. And they're like, I haven't been in school in 15, 20 years. So you bring up so much. And then lastly, when you said something about your adults and shifting into the workspaces and adjusting to COVID, a lot
Mhm.
of us, even ourselves, we were virtual. And
True.
even now, some people either don't want to go back to work or they're experiencing anxiety about going back to work. And you said all of these different mandates are like changing every week, every month, even today. I think I heard something on the radio today where the mask mandates
Mandate.
are
Yeah.
optional, I believe. So,
Right.
what are your thoughts on that before we move on to, our next question?
Well, the mask mandate about taking off the mask.
Mm-hmm.
I'm a little hesitant, but I'm
Mm-hmm.
still, wash your hands, wash your
Yeah,
distance. Still maintaining a safe posture.
yeah.
But like I said, I'm waiting to see what's going to come up around the
Mm-hmm.
corner. I'm still
Mm-hmm.
somewhat cautious
Mm-hmm.
um, with that. I'm a little cautious, but like I said, it's a ever moving train. It's
Yeah.
a we'll see what comes up in about a month or so. We'll see. We'll
Right.
see.
Yeah, I like that. I like that posture of we'll see. In the
We'll see.
meantime, still be safe and do the things that you would normally do. Of course, wash your hands and be
Watch your
safe. Just
distance.
generally speaking, you would want to do that whether we were in a pandemic or not.
Or not.
Yeah.
Hmm.
So you know what, Dr. Trey, I really appreciate everything that you've said so far. I kind of want to switch over from our clients to our colleagues, to the professionals, as we're hopefully moving to spaces of normalcy. Um, what kind of advice or what kind of thoughts would you give for our clinicians, the professionals who are providing the mental health support for our clients and for the parents that we just discussed?
Okay. You said for the clinicians?
For our
Okay.
professional.
Okay. As we continue to live in our new normalcy, adapt, be flexible. And when I tell you this, I'm taking it for myself. Learn
Right.
to adjust. Adapt and adjust, sometimes they use synonymously, but no, not here. Adjust to communication styles of our other colleagues. Okay. So we can communicate well. What we give our clients, if it's appropriate for us, which a lot of it is, communication skills.
Yeah.
Okay. Learn to communicate with each other in this environment as it's changing, because it's not easy. And I teach realness. Okay.
Yeah.
Okay, as you see me on this podcast, this is pretty much my posture in person, as you know, Danielle, and this is my posture outside of the workplace as well. And sometimes we have to admonish some of the ways that we were operating before. And what I mean is, this is here to stay, whether we want it full time or not. And some of the tools and some of the ways we communicated before, were not appropriate. They just don't exist, just like technology is forever evolving.
Right, ever changing, right,
Ever changing, ever evolving, and ever shifting.
Yeah.
And so posture needs to continue to shift, just like the tools that we use to reach our clients. Just like I said, when I came back to work a year ago, as a licensed clinician, I came back in wonderful shock, in surprise. And I was surprised. I came back to tools to help me help others even more than I was before. So for that, I was very grateful. But on maintaining mental health and dealing with my own stress and own anxiety, I'm getting more self-care. Not only is it a mandate for social workers and counselors, I am getting my self-care. If whatever we say, get your self-care. Because if I can't take care of me, I can't take care of my client.
I feel like if I had a bell, I would ring the bell. If I could wave a flag, I would wave a flag. We love self-care. Wendy and I talk about it all the time. Yes, yes, and yes.
I tell people, and it can go up the chain of command here, get your self-care. Make sure you implement it in your day. And it's easier said than done. I have to stop. I have to drop. And I have to say, you know what? I need a break before I break.
Yes.
Okay? I have
wait a minute. One more time. That's a quotable. You need to what? You need to what?
Let me take a break before I break.
Listen, everyone, let's take a break before we break. Okay? To all our clinicians and our professionals out there. One more time for us.
Let me take a break before I break.
Yes.
No games.
Yes.
No.
Yes.
And I've had to step back, and I've had to say, you know what? I've been working on this treatment plan too long. You know what? After this assessment or intake, I said, you know what? Let me just, bring it back. Let me chill. I'm not going to do this today. And when we do that, actually, we become better, and we can refill our cup so that we can communicate and treat others.
Yes, one of my favorite phrases is you can't pour from an empty cup. No. And a lot of times we, as the clinicians, the therapists, the professionals, the counselors, the mentors, a lot of people pull from us because we are equipped. I mean, the reality is we're equipped to do our job. We didn't go to school. We didn't get our licensures. We didn't study hard, for no reason. And we have a passion and a desire to serve in this particular profession. We also need to be sure that we serve ourselves. Absolutely. And we also need to make sure, as you've already said, we have to be good to ourselves so we can be good to others. Sure. So at the end of the day, I love that we're coming down to the end of our interview with self-care. That could also speak to our different anxieties that we may have. Okay, it's time to, like you said, put the treatment plan down. Put the treatment plan down. Take a little bit more time, spread out your clients, or take a day just completely and simply for yourself. Yeah. So I love that you have spoken to self-care. Wendy and I love a little self-care. Okay. So absolutely. Dr. Trey, is there anything else before we go that you want to leave with our listeners, with our audience? The floor is yours.
I just want to continue to thank our ABH family for serving our community. I want to thank you and Wendy for having me on the podcast. Anytime you need me, just to knock on my door, send me an email, send me a text. Don't send me a care extension. I don't know if they still but once again, I'm always happy to serve. And like I said, we can follow up on this, as a case study.
Absolutely.
And maybe we might have a different conversation. Once again, I thank you again for having me.
Well, Dr. Trey, we want to thank you so much. My name is Danielle Young. My co-host will be back with me soon. This is Making a Difference in Mental Health, where we're always striving to make a difference in mental health. We will see you next time.